Hi, I'm Dr. Dan George, GU oncologist at Duke Cancer Institute, and I'm a co-chair of the Duke DCI Center for Prostate and Urologic Cancers. And I'm here to tell you about our poster on radium-223 and abiraterone. Now, many of you may know that the Ra-223 data was presented at ASCO this year, really concerning for the number of fractures seen, 29% with the combo arm. And so we wanted to look to see how much of this was due to the concomitant use of the two drugs versus just the sequential or layered use of two drugs. So we defined concomitant use as the use of the drugs at the same time, layered as starting one or the other at least 30 days apart. And we saw about 3 times as much use of layered as concomitant. This is the Flatiron database. This is looking across the country at community centers with advanced prostate cancer. And overall, about 625 radium patients treated. And what we could see is that there was actually a real trend in lower rates of symptomatic skeletal events and pathologic fractures associated with the layered effect being less than the concomitant effect. So there's something about doing these drugs at the same time, starting, that seems to be worse. Now, the concomitant patients live longer than the layered patients, but overall, these are patients that had a median survival of about a year. So it's not surprising that symptomatic skeletal events are high, but they were no higher in the radium alone than they were in the layered. So it really gives us a peace of mind to say it's okay if patients are on abiraterone first, and then we add radium later, or if they had a prior history of abiraterone. What we really want to avoid is that sweet spot where patients start both drugs at the same time. For whatever reason, that seems to be worse. So that warning label really focused on that population.